Dr. Rana Hajjeh is a distinguished public health leader with over 30 years of experience in global health, with expertise spanning infectious disease epidemiology, women's health, health policy, and regional health management. She earned her medical degree from the American University of Beirut, is board certified in internal medicine and infectious diseases, and is a graduate of the U.S. Centers for Disease Control and Prevention's Epidemic Intelligence Service, class of 1993. Dr. Hajjeh spent over 2 decades at the CDC, where she directed the Bacterial Diseases Division and led the Gavi-Hib initiative, helping introduce life-saving vaccines to millions of children across low-resource countries. Her leadership was pivotal during some of the most critical public health emergencies of our time. In 2016, she joined the World Health Organization's Regional Office for the Eastern Mediterranean, first as Director of Communicable Diseases Prevention and Control, then rising to become Director of Program Management. In this role, she coordinated all technical programs across 22 countries. In 2023, Dr. Hajjeh was appointed President of the Population Council, a global research organization headquartered in New York. Her mission: to drive innovative, evidence-based solutions to health and development challenges, particularly for women and girls in resource-limited communities. She has published over 200 peer-reviewed articles and book chapters, and currently holds visiting professorships at Emory University, Johns Hopkins University, and her alma mater, AUB. Health is not a luxury, it is a right, she says, and our responsibility is to make sure no one, especially the most vulnerable, is left behind. Dr. Rana Hajjeh continues to stand at the forefront of global health, shaping policy, saving lives, and breaking barriers for future generations of women in medicine.
Khair. Thank you very much. This is an amazing video. Actually, I haven't seen it at any other conference, so thank you very much. And طبعا it is a lot. Yeah, تفضل.
It gives me great pleasure to introduce Dr. Hajjeh, who does not need any introduction. The only thing I want to say about Dr. Hajjeh is that in the most difficult period for Lebanon, for the health sector, Dr. Hajjeh was one of the staunchest supporters of Lebanon through all her positions, and especially at the WHO. Also, I think that Dr. Hajjeh was one of the best representatives of the best things that Lebanon have, competent physicians, and it really, I think it's a privilege and honor to listen to her. Please.
شكرا كثير. Thank you very much دكتور فراس معاليك وريلي طبعا أنا مبسوطة كثير إني موجودة بطرابلس. Thank you very much again لنقابة الأطباء بطرابلس ولدكتورة لينا وكل الزملاء for this very kind invitation. It's always a pleasure to be here. To be honest, when Dr. Lina asked me to speak at this conference, I looked at the program and I said, do you really need a public health speaker? You know, the program is very innovative, very clinically oriented. But then she convinced me, like, we need somebody to speak about women's health, which actually made me really think about how to better orient this talk to this audience. So what I will try to do today, of course, as Dr. Ghazi said in the previous session, it's hard to cover really all topics to men's health or women's health. But I wanted to give the audience a bit of a comprehensive view of what is women's health and why it is important to actually talk about women's health. And I was also not known as a women's health expert. As you know, I'm in infectious disease, I'm an expert in vaccines, but as I became more engaged into public health, I realized why it's important to look at women's health from a public health perspective, which is the title of my presentation. So I wanted to start, you know, epidemiologists, we always like to define things. It's good to remind ourselves of definitions. So يعني, what's really health? Health, and that's why I focused on health and well-being, because it's not about curing diseases, it's about preventing them and dealing with them at all stages. So health, as the way WHO defines it, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. I think it's very important for us to do that. And the other thing, before I even get to talk about women's health, I think it's very important to know, as Dr. Firas knows very well, that one of the top priorities of governments, of ministries of health, of countries right now, is to ensure universal health coverage for men and for women. And what is universal health coverage, which is something we use a lot, at least in political and governance fora? Basically, that all individuals and communities receive the health services they need in good quality. It's not just about getting service. It has to be quality service to be effective and without suffering financial hardship. I think in Lebanon, in these times more than ever, this is becoming, and actually maybe this is my opportunity, very humbly, Dr. Firas, to thank you for your efforts, actually, as a minister, to get Lebanon back on the track of strengthening primary health care and the track of reaching universal health coverage for everyone. So why is it women's health, and why it's important to look at women's health, in a different way? Of course, women's health used to be limited to sexual reproductive health. Actually, at WHO, what I consider one of my small achievements is I changed the name of the unit that dealt with reproductive health. It used to be called SRH, sexual reproductive health, to call it women's health, because women's have lots of health issues beyond issues related to their sexual and reproductive health cycles, especially now that women are living much longer, way beyond their reproductive years. And the health of women and girls, as we know, especially in our region, are really heavily affected by so many other factors, not only health-related, but issues related to the social factors, behavioral factors, environmental issues. So if we really need to address women's health comprehensively, we need to look at all of these factors that are shaping their health. We know, and I will show some data from COVID, that outbreaks even affect women in a very different way. And of course, if we look at our region, which معلش يعني إذا بتعذروني, I've been working in the region for 8 years, so it's very hard for me to dissociate from it. But we live in a very intense region with lots of issues, lots of crises, emergencies, wars, humanitarians. In these situations, women's health get even more affected, and they get less attention because the priorities focus on the big issues, on safety, on ensuring shelter, food, and the basic needs. So I think that's why we really need to take all of this into consideration. As I mentioned, this is a region of extremes. I was fascinated by the previous talks from colleagues showing all the high-level technologic advances in various fields, but in reality, if you look at our regions, you have this picture actually is, as you know, from Saudi Arabia. I mean, you have extremes. Our health indicators go from the best health indicators in the world to actually the worst health indicators in the world, especially when it comes to issues related to women's health and some of the issues, for example, maternal mortality. I just wanted to highlight, to start with some statistics. So what I'll try to do, as I said, it's very hard to cover all the issues, but I wanted to highlight what are the key issues for women's health that need attention in addition to SRH. I'm not going to talk much about SRH, sexual reproductive health, because I think you're going to hear quite a bit about it, and it's the more common factors. But as we know, if you look here at this to show some data, these are the life expectancies in the countries in the region. And as you see, overall, women, on the average, live at least 3 years, 2 to 3 years more than men in most of the countries. You see, Lebanon, we're actually, we're doing really well for most of our health indicators. But if you look at it, only about 1.7 years of those, or almost more than half of those extra years, are spent in ill health. So I think it's important. We shouldn't just look at the overall how long are women living. And this is, if you have time, at one point we commissioned a report when I was at WHO with Sir Michael Mermott, who started the whole idea of social determinants of health, to look at the social determinants factors that shape health of people in the region, women, men, and they looked at all the countries in the region, and it's actually a fascinating report. It's online on the WHO website. But if we look overall at causes of mortality, globally. By gender, I think you will see that these data, it takes time to generate timely data. So these data are mainly from 2021, where I could find like really good recent numbers, comprehensive numbers. We have, if you look at all of the global ones, you see that the typical heart disease, stroke, COVID at the time was a big feature in 21, respiratory infections, cancers, etc. It's very important to look at causes of death by sex or by gender to differentiate what is killing men versus women. If you look here, for example, for women, which was surprising, more women are dying from diabetes than men. Of course, breast cancer solely is one of the most common killers of women. But overall, cardiovascular disease, which we always think about it as a male problem, is actually the #1 killer of women globally, especially for women after menopause. And breast cancer is the leading cause of death among women who are 20 to 59. So I think, to have the data is helpful so that we can focus the efforts in terms of prevention, screening, as well as therapy. I just wanted to put some reproductive indicators, health indicators in the Arab world, and I wanted to highlight that, so the total fertility rate, which is one of the key measures of reproductive health, what we now consider adequate replacement level for countries is 2.1, which you see Lebanon is right at 2.1. Many of the countries in the region are still struggling to decrease their reproduction rate. And it's very important to also mention the access of women to reproductive methods. And that's another problem in terms of sexual reproductive health that remains an issue for many women in the region, is the ability to access these products that will allow them to make better decisions about their reproductive health overall. Women's health, maternal health, and maternal mortality in particular is something, I cannot give a talk on women's health without mentioning it, because it actually remains quite a concerning issue for the region. I think Lebanon is one of the countries that is doing really well. We have a very low, actually this is a very low rate of death. I mean, we've seen maybe a little bit increase. I will show Lebanese data at the end again, but overall, we have, just to give you an idea, there are some countries in the region, like, of course, like Somalia, like Afghanistan, Sudan, now Yemen during the war. Syria suffered significant increases in mortality because of the war. And I think that, unfortunately, even in 2025, there are women in the world who are still dying during childbirth, which should not be acceptable. And as we know, the most common causes for maternal death are hemorrhages, abortion, and infections. And all of these are actually preventable. I highlighted this because during COVID, when I was at WHO, we actually did a survey to assess the impact of COVID-19 on the disruption of services. Because as you know, the clinics closed, many of the services were not available, and especially some of the services that require actually visits, direct visits, like prenatal care, others. And what we found is that actually women's health services, especially during pregnancy, prenatal care, were among the most severely affected. And that's important to keep in mind for also future outbreaks and epidemics, to make sure that these services are planned earlier. And interestingly enough, they didn't just have service disruption, but we saw increase in gender-based violence all over the world. It wasn't just in the region. We saw significant economic impact because women were less likely to be employed during the COVID outbreak. So basically, this is just to say that women are differently affected also during epidemics and outbreaks. I want to emphasize again, and I apologize, I'm showing a lot of data, but again, this is a general talk, so I may not stop a lot for the individual slides, but just again to highlight the importance of non-communicable diseases, especially when women are after age 49 or postmenopausal. And if you look here at the rates of death from non-communicable diseases among both men and women, you will see that there are many of the conditions. The female one is in orange, men are in blue, And you could see that in many the rates of death from non-communicable diseases is huge. More than half of the NCD-related deaths took place actually before the age of 70 in the region here we have. And I would like to highlight, I'm actually going to skip on this one. I would like to highlight specifically the importance of cancers, because many of these cancers are now preventable. And I think Dr. Fatin may address the issues of risk management later and how can we prevent many of these cancers. But it's when you look at cancer overall, you're going to get one idea of the frequency of the various cancers. Of course, if you look at it by sex, you're going to find that breast is the number one killer of cancer in women, then followed by colorectal, etc. I would like to talk later about cervical cancer because it's now very preventable versus men, where you see that colon, lung, and prostate are the more common ones. One issue that also deserves really its own talk is the importance of mental disorders. And that's one of the areas, mental health in general, is one of the areas that has been somewhat given less attention among women. And we know from various data, I mean, it was hard to find data from, comprehensive data from the region. This is the last one I found from the whole region. It was 2015, but the recent data show even more increase. This is from Ali Mu'dad and his work on the global disease burden, showing that women in general are at higher risk for various mental disorders, depression, anxiety disorders, and recently we are seeing similar trends for Alzheimer's and some of the other conditions. And again, that's an important issue to be aware of because we need to address these issues more comprehensively. Just few, I cannot be in Lebanon and not address the issues in Lebanon. I think Lebanon overall, especially compared to the global picture and to the region, is among the countries that has the better health indicators in terms of survival of men and women, with the average here of 74. We did see a bit of a dip the last few years due to the various crises, whether it is the COVID, the economic crisis, etc. The one issue also, and these are here, it shows you the top causes of death among women and men in Lebanon. If you ignore COVID and maybe look at the other, you will get an idea. Again, highlighting the importance of like breast cancer being in the top 5 for women, strokes, cardiovascular diseases. The one thing I think to keep an eye off, even though maternal mortality in Lebanon is doing quite well, we did see some increasing trend over the last few years, and maybe I think maybe Dr. Abiyat can address it more, but it probably has multiple reasons, mainly access to care, probably some of it COVID, poverty, the economic crisis. But these things kind of creep up very easily, and it's important to keep an eye on them. Okay, so now this is a kind of a very high-level overview of the issues, the important issues for women's health. So how should we address them? And increasingly in the world now, we are moving toward a life cycle approach to address health. So instead of just looking at one disease, we look at it as what we call the life cycle approach. We start looking at health of girls from infancy, but especially adolescent girls now are getting more and more attention because this is the stage where you really prepare for women to become adults and where we can prevent a lot of the diseases to full adulthood to older age. And each one of these periods, whether it's infancy, adolescence, reproductive years, or post-reproductive years, has its own issues that need to be addressed preventively. And again, we have to be aware that some of the issues remain throughout the lifetime approach. I think it's really important to make sure we focus on prevention. We don't hear a lot about prevention, but prevention, as we all know, is much more cost effective. There are many diseases that are fully preventable, diseases that are really killers of women. So there are many health screenings that need to be done on a regular basis. Of course, I put here some of the top issues like looking at osteoporosis, breast cancer, of course, cervical cancer, which is really important. One of the top 3 cancers for women is cervical cancer. But also, some of these are almost completely preventable if we screen for them. I couldn't put everything. Of course, you need to do the diabetes screening. Breast cancer now, as we all know, if it's detected early with mammograms and breast exams, the rate of survival of stage 1 breast cancer is 99%. When I was a medical student, I never thought that we would reach these statistics in our lifetime. This is amazing, and that's why I think it's very, very important to do the early screening, which is very simple to do. Colonoscopy, which is, as we saw, among the top also cancers of women, can detect more than 95% colorectal cancers. I go here, when I come here, I remind all my family who are over 50, did you do your colonoscopy? It's one of these procedures that is always missed. This is one of my big pet peeves, I guess, if I want to call it, is the vaccines. And I hope that in Lebanon, I know that they were seriously considering introducing the HPV, human papillomavirus vaccine, in the national program. Unfortunately, Lebanon doesn't benefit much from, maybe some benefit from Gavi, but HPV vaccines are extremely effective. They are now used in almost 150 countries around the world. And they're probably among the most effective vaccines right now we have on the market, and they can reduce the invasive cervical of cancers when we give them to girls at young age. That's another, I think, miracle of the 21st century, that for the first time in history, we are actually eliminating a cancer. There's a major initiative now in the world to eliminate cervical cancer completely, because it can be eliminated with vaccination. Actually, I wish I can do that also. My last thing at WHO before coming is getting Pakistan approved to introduce HPV vaccines. In Pakistan, 9 million girls every year get vaccinated. It's a huge country. So 9 million girls are getting the opportunity to actually have a life-saving vaccine every single year. So there's a lot we can do for prevention. I can go on and on this for hours. I want, of course, to talk about all the important, I don't want to take us in the old ages, but we have to join the new age and the innovative technologies. There are huge opportunities with e-health, with telemedicine, with many of the social media that can promote healthy lifestyle, the focus especially for women on physical activity and nutrition, which are very important behaviors to encourage. And there are tons of mobile apps. They are used in many countries. Actually, I think during COVID, they became very popular because we had to use e-health more, and people found them very, very effective. And in many places now, they are replacing even clinical visits. And that's, I think, tons of opportunities for technological innovations that we should take advantage of. So how do we move on with this on a more kind of a global level or high level at the country level? It's really important to have global strategies for women. This is the WHO strategy. It was established in 2016 and goes till 2030, which is the date when the world is supposed to meet the targets of the Sustainable Development Goals. It's very important to have strategies that focus on these issues. It's very important for women's health to have a multi-sectoral approach and intra-sectoral. In Lebanon, this is not even just the responsibility of the Ministry of Health. I mean, Ministry of Environment has a role, Ministry of Labor has a role, Education has a role, and I think it's very important to make sure that whenever a strategy is developed that includes not only access to healthcare, education, how is women's health addressed in employment, in workplaces, resources are needed, the environment, the community engagement, and of course the right policies and strategies are critical. I really wasn't aware of it, Dr. Abiad, but when I was looking, I saw this, that Lebanon has actually developed a national strategy for women from 22 right after COVID to 2030, and they also developed an action plan that will basically ensure the implementation of some of these recommendations. I think without strategy, without a roadmap, it's very hard to really achieve many of these targets. So, sorry, it was a bit fast, but I just wanted to conclude that for women in general, we really need a comprehensive approach to address the physical and mental health needs, taking into account that complex interplay between all the factors that affect their access to services, and we need to adapt it to the needs of the various communities. What's needed in Tripoli or Bekaa is very different from what's needed in maybe Beirut. Village level needs are different from urban communities, and it's very important for all the colleagues here, the health practitioners, as well as the policymakers, to have really this role, to play this role to improve health outcomes, strengthen the delivery, and reduce the inequalities among people so that we can really achieve better health for all, for men and for women, and address preventive, promotive, curative, and rehabilitative, as well as palliative services. So thank you very much for your attention.